My name is Alex Baldridge, and I am a third-year medical student at OSU presenting our project on the usefulness of randomized clinical trials on prostate cancer screening on behalf of my colleagues, student doctors Eddie Bagaruka, Eli Paul, and Chance Bratton, as well as Dr. Vassar. We investigated this issue due to prostate cancer remaining the second leading cause of cancer-related deaths worldwide, with an estimated 1.2 million new cases and 358,989 deaths reported in 2018 alone. Screening for prostate cancer has been a topic of significant debate, with the goal of identifying methods that reduce mortality, achieve high predictive value, and maintain low false positive rates. Effective screening methods should focus on patient-centered outcomes such as quality of life and cost-effectiveness, while balancing the benefits of early diagnosis with risk of overdiagnosis and overtreatment. Randomized clinical trials are the gold standard for evaluating the effectiveness of prostate cancer screening methods, including prostate-specific antigen testing, digital rectal exam, and transrectal ultrasound. However, there is a growing concern in the research community on the issue of waste in clinical trials, with inefficiencies ranging from poor utility of information to misallocation of financial resources. Clinical trial waste can be put into perspective when analyzing the clinical trial market value, which was $80.7 billion in 2024, with 50% of clinical trial resources being lost due to poor research design, publication practices, and reporting quality. To address trial inefficiencies, a tool was developed in 2022 to assess the usefulness of clinical trials across 8 criteria and 13 specific items. This tool focuses on identifying design weaknesses, providing structured feedback, and reducing waste in randomized clinical trials. Studies in obstetrics and pediatrics analyzing the satisfaction of the usefulness criteria developed have shown that less than 10% of trials met even half of the usefulness criteria, highlighting significant gaps in trial design. Our study aims to assess the applicability of the usefulness criteria to randomized controlled trials on prostate cancer screening with the goal of minimizing waste and improving research quality. We conducted a systematic review of prostate cancer screening randomized controlled trials published between 1994 and 2024 following PRISMA guidelines. Using PubMed and Embase databases, we identified 312 articles, narrowing down to 154 full-text articles with exclusion criteria available in Diagram 1 provided. The review process was double-blinded and masked, ensuring reliability and consistency. Each of the 13 analyzed items were scored on a scale of 0 to 2, based on whether the criteria were fully met, partially met, or not met within the trials at all. Examples of some of the criteria with a corresponding description can be seen in Table 1. To gain deeper insights, the total scores for usefulness criteria were analyzed separately from transparency criteria. These scores were then examined over time and compared to one another to identify trends and potential areas of improvement. Our key findings indicate that the highest usefulness score recorded was a 20 out of 26, with the lowest score being a 3 out of 26, and an average score of 10.3 out of 26. Analyzing the usefulness criteria revealed that only 23.8% of studies fully met the patient-centeredness criteria, whereas 70.1% failed to satisfy the information gain criteria. Transparency issues were also significant, with 75.5% of studies failing to pre-register and 88.4% not making their protocols publicly available. Linear regression analysis showed a slight positive correlation between the sum of usefulness criteria and publication year. However, a stronger positive correlation was observed between transparency criteria and publication year. This suggests that while advances in research have improved transparency aspects, such as publicly available funding and conflict of interest disclosures, progress in addressing usefulness factors like context placement and patient-centeredness remains insufficient over time. These findings highlight critical gaps where studies fall short in meeting essential aspects of transparency, generalizability, and reproducibility. As a result, a significant portion of prostate cancer screening studies contribute to clinical trial inefficiencies and ultimately waste. By addressing these shortcomings, researchers can enhance the relevance and impact of clinical trials on prostate cancer screening. Minimizing waste in clinical trials requires stricter adherence to established usefulness criteria, similar to the one analyzed in our systematic review. Future research should prioritize improvements in trial design and ensure efficient resource allocation to maximize patient benefit, not only in prostate cancer screening, but across various medical fields involving clinical trials.